All right. Well, welcome everybody.
Thank you.
Thank you.
So
Hello.
before we get into the Q&A portion, first of all, for anybody in the audience that would like to ask a question, you can raise your hand in Zoom. The instructions will be in chat, and they're there now. If we could go ahead and start, I guess we could start with you, Dr. Ingles. Just to tell what you've been up to, give more of a current update on your bio and whatever you want to share about what you're doing these days.
I still have a very active clinical practice. I still have a brick and mortar practice as well as a telehealth practice, and still see again a lot of people with Lyme disease, autoimmune disease. I myself also have MS, so I work with a lot of MS patients. So it's really about helping people, find the right path through diet, lifestyle, and natural means to achieve better health.
Great. And Jennifer, you can go ahead.
I'm still working in the pre-ESRD space, seeing people who are trying to avoid the dialysis chair. I published the book that was just shown was the first book I wrote. I published my second book this time last year. So it's plant-fed kidneys for the patient. And the reason is because the original one was to raise awareness of actually that there is hope to treat kidney disease with with diet. But the patients read that book and said, you didn't put recipes and you didn't do this or that. And it was really written for practitioners. So I wrote the second one for patients.
They
So
always
it's
want
plant-fed kidneys for the patient.
they always want more and more and more. All right. And Dr. Leterman, how about yourself?
Yeah. So my wife, Dr. Alona Polde, and I created the sort of paradigm on chronic disease reversal, but then more importantly, how to optimize health and well-being, ultimately experiencing more joy in your lives, and how to do that. We wrote a book that talks about the 9 pillars that we believe are essential and at the foundation of experiencing more joy and optimizing your health, and then help people apply those pillars to their lives. So it's one thing to understand them cognitively, and then there's another to actually start integrating that into your behaviors and start making the changes. So we work with a lot of patients that struggle when diet alone doesn't work, or some other individual modality, because we really focus on integrating a bunch of different modalities, and we'll whether it's highly anxious, stress, panic, that type of area, or chronic pain, or gastrointestinal issues that just don't respond no matter what they do. We're getting all of the people that conventional healthcare systems find frustrating, and we find them really rewarding to work with. So we most recently coined a term, connection medicine, and that's a big piece of what we do as well, which is around teaching and helping make the case for people that how you connect with someone else affects your physical health, how you connect to what's going on inside of you, what you're feeling and eating, as well as how you communicate to other people, actually affects your immune system, cancer promoters, all sorts of different pieces of your health that need to be addressed, as well as what you eat and medicines you take and interventions you pursue. So we put that all together for people and get a really good outcome.
Great. And just people who've been watching us all day. So your wife was on just a couple of segments ago, Dr. Alona Polde, right?
Yeah,
So
Dr. Alona Polde, yeah.
Okay. How do you say your name? I'm sorry.
Alona.
Alona. All right.
Yeah.
I totally destroyed it then before. So I hope please ask for my forgiveness. So so what led you to, all right, so this is for you. So what led you to focus on the importance of authentic connection with family, friends, colleagues, spirit in the natural world, in achieving wellness, and why isn't something, given, I'm assuming that your thesis is that how important this is. How come it's been missed in traditional or conventional medicine?
I think it's something that people understand intuitively. Oh, connection's good. Sort of like when we got into the plant-based diet, a few decades ago, where people would say, yeah, diet's important, healthy diet's important, but what's it going to do? What's the real, make a little bit of a change. When you got to a whole foods plant-based diet, right? And you really made big changes in your diet, huge changes in your health occurred. Similarly, with connection, I think we're a little bit early in the curve here, but the data is coming out that how you interact with other people affects all, your autonomic nervous system, affects your immune system, affects all different parts of your body. And that has a huge impact, specifically if you really shift how you interact with your environment, how you interact with your world. And then we sort of experienced it myself, dealing with some chronic pain issues and some other health issues that didn't get better despite optimal diet, exercise, and sleep and things like that that are common in the wellness world. And then I said, wow, this is pretty impressive. And then it started changing, my life for the better. And then I said, hey, we are to really help patients with this. And then also at the same time started connecting with a whole area of science and different researchers that were exploring this, but are not really getting the amplification or getting the stage to present their work as much as I think is necessary or needed. And putting that all together, it makes a lot of sense, just like, a healthy whole food plant-based diet did, 20, 30 years ago.
So it almost sounds, and I'm going to handle this somewhat conversationally. So if anyone else wants to jump in on any particular question, by all means, feel free. You guys all have different backgrounds. So if you want to jump in, that's great. I have questions that are geared, more for each of your specific expertise, but and I just want to follow up on that. So it's actually, from what I'm hearing, it kind of sounds like the same way that the medical industry looks at, symptoms and organs outside of the context of a holistic being. They're looking at individuals outside the context of community and their social fabric.
Right. And now the science is coming out. For example, if you have a doctor that interacts with the patient and it's a high empathy doctor compared to a low empathy doctor. So just how the doctor connects with the patient. If you have a high empathy doctor, they found that patients in one study had 25% better LDLs, 29% better hemoglobin A1Cs. Another study looked at acute metabolic complications when you had high empathy doctors versus low empathy doctors, and it was 41% lower odds of having acute metabolic complications. So how the doctor treated the patient affected or seemed to be correlated with the patient's health, right? And the same thing with pain, right? If you got the same painful stimulus from a doctor that you had high trust with compared to a low trust doctor, the high trust doctor had you registered less pain from the same stimulus. So it was the same stimulus, but the pain felt less, and the pain centers in the brain lit up less if you had high trust doctor. So in other words, your relationship, your sense of, ultimately it comes down to sense of safety, how much your autonomic nervous system is putting you into threat physiology affects your experience. It affects your health. It affects even, pro-inflammatory cytokines are released when you go into this threat physiology. We know that increases insulin resistance, right? So all these things are starting to connect and make sense of everything that we knew intuitively was important. But now it's essential that we include that in our healing models.
Thank you. And anyone want to add into that before I move on to the next question?
I can't remember who said it. It might be Voltaire, but I think the saying something like, the doctor's job is to amuse the patient while nature heals. And I think to a certain degree, we're alluding that, the body has this wisdom to heal. We just got to get out of the way and give it the tools to do that. So I completely agree with Dr. Lederman saying it's like your ability as a practitioner to influence someone's belief in their ability to heal, their belief in what they're doing for their treatment, I think has huge impacts. And I can remember as a young doctor seeing these doctors that would do something that worked beautifully for a patient. I would go in as a new doc and it didn't work at all. And I'm like, well, gosh, if it's the same thing, why isn't it having the same outcome? And it could very well just be the belief in an experienced doctor who had the confidence in it versus a newbie who didn't. Maybe that was the big difference. But
and I've seen videos of kids getting shots, and you can see their response be drastically different when they're being soothed and calmed and they're handled compassionately versus if a doctor just kind of grabs them, doesn't really care, and just jabs them and it says next. So you could definitely see that type of reaction, and you can imagine like the fear and the anxiety that gets built up having physiological effects on an individual. So it intuitively makes sense.
Exactly. Helping, I think one of the most important things we can do as practitioners is to help patients feel safe and to feel cared for. And if we do that, we all of a sudden shift their physiology in a way that allows their natural healing abilities to be realized, right? I think that's, we'll have patients that will say, "Hey, I've had panic, I shake, multiple times a day, and I'm waking up with panic attacks." And we teach them how to experience safety, and over a period of time, then they'll say, all of a sudden, I've had a panic attack in a month. And it's a shift in their whole physiology that happens, that medication alone, or or a doctor coming in for 10 minutes and looking at the chart and not even looking at them, right? You can't heal that. You can't fix that with those type of tools or that type of interaction with patients, right? So I think it's so important that we realize this broader approach.
And what is the response from, science or medicine is considered like a hard science. And this, it's very easy for people, regardless of what the evidence suggests, especially in the medical community, to look at this something new as soft. And what kind of response are you getting back from professionals? Do they recognize, do your colleagues recognize that how they treat people is going to affect, or how they are in their own community, whether or not they are isolated and alone, will affect their health and their healing?
Right. I mean, there's definitely this bias that is soft, right? This is touchy feely. This is soft, but medicine, and that medicine is the answer, and that pills are the answer, and that a randomized controlled trial is the only thing that matters. And right. But at the same time, how's that working for you? Right. And we get all these patients that are really struggling, and people, depression, anxiety, gastrointestinal issues, chronic pain. I mean, you name it. There's so much of it, right? And to me, even if it's soft, if it makes their lives better, forget about the fact that it actually can heal and help heal. And I don't think it's one or the other, right? I think diet's important, sleep is important. Sometimes medication is actually important, right? And to me, but it's don't take some and throw out the other. Why not put it all together, right? And I think there's this idea of, oh, is it this or is it this? Well, this is soft, so this is the only thing that matters. And to me, it's everything that matters. And just because you can't measure some things as easily as others doesn't mean that they're not important.